Hypertension or high blood pressure already affects 1 billion people worldwide. It is a major concern in African region where some years ago, in 2000, an estimated 80 million adults were affected. And as we heard from previous presentations, without preventive actions, an estimated 150 million people will suffer from hypertension in the African region by the year 2025. And hypertension can affect everyone. Most of the people affected by the hypertension are often not even aware, as we heard from previous presentation. And the reason why it's also known as a silent killer. We also have that the effects of hypertension over time may include heart attack, kidney failure, stroke, disability, premature death. More than 1 in 3 adults worldwide has high blood pressure, and the proportion increases with age. From 1 in 10 people when we are in our 20s and 30 years to 5 in 10 when we are at my age, over 50s. Prevalence of high blood pressure is highest in some of low-income countries in Africa, with over 40% of adults in many African countries thought to be affected. Some sources are even indicated that 37 to 44% of our adult Kenyan population has hypertension, and this is alarming. Ladies and gentlemen, we may ask ourselves what is contributing to the high numbers of affected people in our countries in the African region. We heard again from the presentation, but I think, and from the students, but repetition is good for health promotion. Unhealthy lifestyles characterized by unbalanced diets, lack of exercise, smoking, harmful use of alcohol, coupled with the stress. All these factors increase the chances of development of high blood pressure. The condition may become a drain of the financial resources of the majority of people affected who become chronically ill, because when we are affected by hypertension, it may become chronic. In recent times, there have been new opportunities to tackle hypertension. Countries in the African region have committed themselves to strengthen the prevention and control of the hypertension and the other non-communicable conditions and diseases by adopting what we call the Brazzaville Declaration on NCDs that was adopted by all the ministers of health of the African region in April 2011, and also the UN high-level meeting political declaration on non-communicable diseases that was adopted by heads of states in the United Nations General Assembly in September 2011. So we can see that the 2011 was really a year of advocating for the control, the prevention and control of non-communicable diseases, which includes, as we are saying, the hypertension. This shows high-level political commitment, but these commitments, as it was also said by the presenter, have to be translated in national policies and strategies at country level. And at this point, I would like really to commend the Ministry of Public Health and Sanitation for taking a step ahead in terms of having tools to, at national level, prevent and control non-communicable diseases. Let us clap. Ladies and gentlemen, you will agree with me that addressing the problem of hypertension requires that countries, indeed all of us, and the role of the media is fundamental, should strengthen public awareness of the risk factors and take appropriate measures for its prevention, early detection, and treatment. This should be done in the context of multi-sectoral policies and strategies that promote universal access. I think that it's important to underline that high blood pressure is in most cases both preventable and treatable. Taking into consideration what was identified as risk factors, we can say that the risk of developing high blood pressure can be minimized through reducing salt intake, keeping a balanced diet, avoiding harmful use of alcohol, having regular exercise, 30 minutes per day, not 30 minutes per week. 30 minutes per day. And abstaining from tobacco use. I think the youth presented us all those. For many people, lifestyle changes alone are sufficient to control blood pressure. However, if these measures are not sufficient, your doctor, daktari, will advise on the appropriate medication. And please follow the advice of your doctor. In theme is to create a greater awareness worldwide. We are not the only ones celebrating, others are doing, we are joining the entire world, of the causes and consequences of high blood pressure. Let me therefore use this opportunity to urge all Kenyans to embrace a culture of healthy behaviors by eating healthy foods. We were asking ourselves if our breakfast qualify to be healthy foods. And I don't know what is your opinion. Reduce salt intake, avoid tobacco use and use of alcohol, and control your body weight. You know, in our African culture, sometimes, to be abundant, it's part of our culture, but it's a risk. Please control your weight. I also encourage all adults to check their blood pressure and to follow the advice of the healthcare professionals. Let me conclude by encouraging the ministries of health, the county governments, and the health professionals to give utmost importance to early detection and treatment of hypertension and prevention of its consequences and complications, and to implement the standardized guidelines for hypertension management starting from the primary health care level. To the public out there, and this is a message for you, the media, my message is prevention of hypertension is possible. Please embrace a culture of healthy lifestyles, and please check your blood pressure on a regular basis. I therefore reiterate the commitment of the World Health Organization in supporting the government and other partners' efforts in prevention and control of hypertension, and indeed, comprehensively, the non-communicable diseases and conditions. Just remember, high blood pressure is, let us repeat, high blood pressure is, please go for checkup. Asante sana, I thank you.
It is a pleasure to be here when we commemorate this very important day. World Health Day is a global event which is celebrated every year in April to mark the founding of the World Health Organization. Each year, the WHO selects health issues of public importance and encourages people from all walks of life to hold events that highlight its significance towards good health. World Health Day provides a unique opportunity for communities and policymakers from across the world to come together for one day to promote actions that will improve their health and also make sure that policies are implemented from that theme. The momentum of health education and awareness set during the World Health Day should be continued throughout the year. Ladies and gentlemen, the theme this year is hypertension, and in Kenya our slogan is hypertension is a silent killer. Be safe, go for a checkup. The theme focuses on prevention and control of high blood pressure in order to reduce the number of people affected now and in future. This will go in a long way in reducing heart attacks and stroke. High blood pressure is a concern for each and every one of us, irrespective of our age and social status. High blood pressure, scientifically or medically, is known as hypertension. It is the force of blood against the inside of blood vessels created by pumping of the heart. High blood pressure or hypertension is listed amongst the major non-communicable diseases such as diabetes, cancers, and other heart diseases. High blood pressure is commonly referred to as a silent killer as it produces no signs and symptoms. Many people are diagnosed when complications have already set in. Consistently, high blood pressure can lead to damage of important organs in the body such as heart, brain, blood vessels. This leads to heart attacks, strokes, kidney failure, paralysis, long-term suffering, and death. Besides all this, the families are left in poverty due to enormous cost of treatment. Ladies and gentlemen, it is important to note that high blood pressure is on the increase globally, and more so for those aged 50 years and above. The average blood pressure in Africa is now higher than in Europe and the US, and the prevalence has increased tremendously amongst the poor section of the society. In Kenya, non-communicable diseases, that is abbreviated as NCDs, contribute half of the top 20 morbidity cases, and raised blood pressure is estimated to be 37% among those aged 25% and above. The situation is of great concern as this is the most productive population of our society. To address this, the ministry established the Non-Communicable Disease Division, which provides leadership in prevention and control of non-communicable disease where blood pressure falls. Along with this, ladies and gentlemen, each individual is called upon to take control of his own health by adopting a healthy lifestyle, such as eating food that contains less salt and fat, avoiding excessive alcohol intake, having regular physical exercise, avoiding tobacco use. This is to mention a few. And this will ensure that blood pressure remains normal in our population or individually. It is important to note that changes in global economies, education, social status, and other social determinants of health have had significant impact on health of people today. More and more people are moving to urban areas, living and working in cities, family patterns are changing, and technology is evolving rapidly. At this point, ladies and gentlemen, allow me to highlight some important facts on high blood pressure. One, it increases the risk of heart attacks, strokes, and kidney failure. If left uncontrolled, high blood pressure can cause blindness, irregularities of the heartbeat, and heart failure. The risk of developing this complication is higher in presence of other cardiovascular risk factors such as diabetes. 1 in 3 adults worldwide has high blood pressure. This proportion increases with age. 1 in 10 people among those in their 20s have high blood pressure, and 5 in 10 people who are at the age of 50 have high blood pressure. Prevalence of high blood pressure is highest in some low-income African countries, with 40% of adults in many African countries affected. Ladies and gentlemen, at the expense of repeating myself and what the others have said, let me highlight some of the risk factors for high blood pressure. Eating foods that contain too much salt or fat. The recommended intake is less than 1,500 milligrams of salt per day. Excessive intake of alcohol, whether frequently or occasionally. Eating less fruits and vegetables and whole grains is a risk factor. That means you have to increase more. In physical inactivity or exercise, that is a risk factor. Tobacco smoking, chewing or sniffing is a risk factor. Being overweight or having